Okay, looks like we've got a nice crowd to go ahead and get started. Good afternoon. My name's Charmaine Anderson. I'm the Director of Advocacy for Allergy and Asthma Network. And I'd like to thank you for joining me today as we gear up for Allergy and Asthma Day on Capitol Hill, otherwise known as AADCH on May 8th. We at the network are looking forward to welcoming you to DC. And I'd also like to extend the network's appreciation to the American College of Allergy, Asthma, and Immunology for their consistent support of this event. We couldn't do it without them. A few housekeeping items before we get started. This Zoom's going to last about an hour, hopefully not too long. We are going to keep you on mute, so please use the chat function to type any questions you have during my presentation. I hope to answer as many questions as time allows at the end. And this presentation is being recorded and will be available on our website in the next day or so. So you can certainly refer back. Today, I am pleased to be joined by Kevin Schultz, the president of Soapbox Consulting, who later in the presentation will discuss schedules and meeting logistics. It's my understanding schedules will be emailed out tomorrow, if not tomorrow, certainly by Friday. I would like to highlight that Soapbox has been engaged with the network and AADCH for nearly 10 years, helping to coordinate Hill meetings, and we greatly appreciate their efforts because that is no easy feat with the number of folks that come to Washington to participate. I always like to start with our mission and our core belief. The network's driven by our mission by working together to end the needless death and suffering due to allergies, asthma, and related conditions through outreach, education, advocacy, and research. Our theme this year for AADCH is Breaking Barriers, Advancing Health Equity for All. This theme reflects our dedication to ensuring that healthcare policies prioritize access, affordability, and equity for individuals of all races, ethnicities, and socioeconomic backgrounds. And we value your advocacy in helping us raise awareness about significant issues affecting our shared community. The network's engagement and policy is determined by these 5 priorities, which we believe lead to patients achieving optimal health outcomes. The first being access to care. We advocate for policies that ensure all patients have timely and affordable access to high-quality healthcare services, including specialist care for allergies, asthma, and other related conditions. And this includes efforts to reduce barriers such as insurance coverage gaps, provider shortages, and long waiting times for appointments. Next up, funding for asthma and allergy programs. We push for increased funding at both federal and state levels to support education initiatives that raise awareness about the conditions that we all face. Additionally, we advocate for research funding to advance treatment options, as well as community engagement to empower individuals and families with knowledge and resources. We also seek to reduce health risks that lead to those healthcare emergencies. Our policy efforts target strategies to identify and mitigate health risk that can escalate into emergency situations for asthma and allergy patients. This includes advocating for preventative measures and medications, early detection protocols, and improved emergency response protocols in and out of healthcare settings. Next step is eliminating environmental health hazards. We work toward policies that address environmental factors contributing to allergies and asthma, such as air pollution, indoor allergens, and exposure to harmful substances. Clean and healthy environments that minimize triggers is our goal. And lastly, we support policies that prioritize targeted interventions and personalized healthcare approaches, which includes advocating for evidence-based treatments, patient-centered care models, and initiatives that address health disparities within our patient population. Listed here are some key data points which many of you have seen with the talking points that were shared with you. related to asthma and allergies in particular. This will be important to share with the members of Congress and staff who are not overall, familiar with the conditions or the overall impact. And just to highlight, more than 25 million Americans suffer from asthma, with over 50 experiencing allergies. Asthma is prevalent among children and is known to be the #1 reason for school absenteeism. And of the 50 million people who have allergies, close to half of them have food allergies, which includes 4 million children. And I always find it important to stress that anaphylaxis is real and poses a severe, life-threatening risk that requires immediate treatment. Because I've known, just even with my own children who have severe peanut allergies, that individuals who do not suffer from severe allergies oftentimes find it hard to understand that an anaphylaxis emergency is potentially fatal, and if not treated in a timely manner. So certainly highlight, that particular point, because we want to make sure people understand just the magnitude of what it really means to live with severe allergies in general. And then lastly, these conditions disproportionately affect non-white populations, particularly those in disadvantaged and urban areas. And certainly you can see just the healthcare costs related to asthma reaches $80 billion annually, with an additional $25 billion for food allergies and $8 billion for seasonal environmental allergies. And these numbers equate for just, direct and indirect costs. And we're talking lost time from work, lost time from school, in addition to your more direct healthcare expenses. So what is our message? We are there to address ways to improve health outcomes for those living with allergies, asthma, and related conditions. We want Congress to help by developing and supporting policies that leave no one behind in their healthcare journey. And we recommend improving access and affordability in healthcare, developing health equity interventions, and enhancing clinical trial diversity. And I'll dive into these three just a bit. Out-of-pocket expenses, high-cost medications, and utilization management tools like prior authorization and step therapy can be costly and time-consuming and create barriers to care. This can lead to patients not filling prescriptions, reducing their dosages, or even seeking alternative therapies due to just the cost constraints. We want improved access to emergency medications like inhalers and epinephrine in our schools and in our public places. We want to reduce those utilization barriers and support shared decision-making between a patient and their provider, and address affordability issues. When we talk about health equity, social, economic, environmental factors lead to unequal health outcomes. There's transportation issues, there's language barriers, there's income, education, employment, housing, and even where you live can be a barrier. Targeted interventions are needed to help those who live with chronic illnesses. For instance, we need regular checkups and specialist consultations and medications, which can lead to making sure everyone can get the care they need, and also teach people about staying healthy and provide care that respects everyone's background and culture. This ultimately leads to better health outcomes, lower healthcare costs, and improved quality of life for all patients. And lastly, when we talk about clinical trials, many of which lack that diversity, because then it leads to unreliable results and disparities in healthcare outcomes. For instance, findings may not accurately represent how the treatment or intervention will work across different demographics. If certain groups are underrepresented, the benefits and the risk of the treatment may not be fully understood for them. Different populations also may respond differently to treatments due to genetics, biological, and/or cultural factors. So we want to see funding to help incentivize and help with outreach programs, community engagement, and standardized data collection on demographics in order to have advancements in medical research and safe and effective treatments for everyone. And lastly, we want Congress to support some key bills that are currently pending in Congress, with hopes to see them get to the finish line and become law. And some of these bills listed here, you may be familiar with, as we advocated for them last year. If they are not signed into law by the end of this year, however, they will need to be reintroduced under the 119th Congress that begins in January 2025. So just to kind of run through these 5 particular bills that are on the screen currently, the Safe Step Act, again, one that was introduced last year. Basically, health insurers often use step therapy. And if you're not familiar with the term step therapy, you can sometimes hear it referred to as the fail first policy. Step therapy happens when insurers require patients to try and fail on 1 or more medications before the plan will cover the treatment initially determined by the patient and their healthcare provider. So this bill will help to control those costs, because oftentimes when there's delays in getting the proper treatment can lead to a patient's medical condition getting worse, and it can lead to increased costs by the delays. We've known that asthma medications are especially prone to step therapy because health plans frequently change the list of preferred medications they cover. This bill puts clear requirements and timelines around the practice of step therapy, and it also gives patients and doctors a way to appeal step therapy requirements when a patient needs a particular treatment. The Help Copays Act, many of us rely on manufacturer type cost savings assistance. And this bill will help, which covers, or I should say, this bill requires health insurance providers to count copay assistance toward a person's insurance deductible or out-of-pocket maximum. Historically, when someone uses cost-sharing assistance, the amount has been counted towards their insurance deductible and maximum out-of-pocket limit. However, recent policies, mainly by health insurance companies, have blocked those contributions from one's deductible, resulting in more cost to the individual. So basically, we're trying to keep more money in your pocket. The Epinephrine Pharma Inflated Price Ends Act, referred to as the EpiPen Act, this bill aims to make basically epinephrine auto-injectors more affordable. It caps out-of-pocket costs for a 2-pack of epinephrine at $60 for patients with employer-based or individually purchased health insurance. Currently, there are several states, Illinois, New Jersey, and Washington in particular, that have passed laws to cap prices, but federal legislation is still needed to lower the cost nationwide. The Family Asthma Act, named after former Congressman Elijah Cummings. This bill expands federal, state, and local efforts under the CDC's National Asthma Control Program to all 50 states in order to improve the care for individuals living with asthma, with information and education, and the development of state plans around the public health response to asthma. Currently, there are only 25 states involved in the program, so we're hoping to expand it to reach all our states within the country. Last but not least, Dillon's Law, which is a new bill that was introduced that we have been pushing. This bill encourages states to allow Good Samaritans to administer epinephrine to a person experiencing anaphylaxis. This bill is a version of a Wisconsin bill that was inspired by an 18-year-old named Dylan Muller from Wisconsin, who died from a bee sting because he was unable to receive medication on time. And this legislation would make epinephrine training more widely available, so individuals with hopes to prevent tragedies like Dylan's from occurring nationwide. I will also just get a little notation here about Dillon's Law. We worked very closely with some members in the Wisconsin state legislature just over the last year and a half to help push policy there in the state of Wisconsin to allow for all types of epinephrine treatment therapies to be utilized, whether it's through school stock programs and others. So thereby, as new treatments come online, families can make a decision whether they want to use, the varying types of treatments that we know that are coming, like nasal sprays and potentially sublingual under the tongue type treatment therapy. So Wisconsin has really been kind of in the forefront of the allergy march, as one would say, in regards to preventing and really protecting those who live with severe allergies. And we've been working also with the state of California, who too is now working to open up their legislation in the states to allow for any type of epinephrine treatment therapy that's been approved by the FDA to also be available to patients and families. And so we're kind of, moving across the country, because most states have still where epinephrine auto-injectors are in law. So we just want to make sure that there is availability for all those treatment therapies once they become approved are available to, again, patients and families. And last, as far as just, our ask and our request of Congress is talking about pending the federal health programs and initiatives that need funding that really support asthma and allergy programs. These programs identified here help support disease awareness, management, and research to support our shared community. And currently, members are considering funding for the federal agencies, and we want to make sure they continue the support for these programs in the fiscal year 25, which begins in October 1st, depend upon if Congress can get the bills passed by then. But ultimately, we do want to see continued funding for these programs. And I would like to highlight the first bullet point with the CDC's National Asthma Control Program. We've been working very closely with some of our like stakeholders about this particular program. And like the Family Asthma Act, we really want to see this program expanded across the country. And as I mentioned, currently, there's only 25 states that have this program available to them. And most oftentimes it's because of funding. So we're seeking $40 million as a request for this program in the upcoming fiscal year in hopes that it'll allow for further expansion of the program. So I'll make a note of this again at the breakfast on Wednesday morning and have some information in your leave behind folder because we really want to get members signed on as far as support that effort in regards to additional funding for the National Asthma Control Program. This next slide just kind of highlights our engagement in social media. I know we have communicated with you all who are had past experiences with us at AADCH about utilizing social media to communicate to your elected officials and certainly just post about the event. We will have sample social media posts available to you in your folders. We'll also be posting some information online. So you can send messaging, whether it's by all the various ways through Facebook, Instagram, formerly Twitter, now X, and all those social channels that, can really reach the members. I will tell you, their members and staff certainly take note and pay attention to those messagings that come through social media. It's kind of their way of engaging with their constituents and the general public. So anytime you can share some information and highlight kind of your experiences of next Wednesday, and certainly just the conditions overall and really just pushing Congress to really make change, we would certainly appreciate that. And we would ask that you use the hashtag AADCH 2024 in any of your posts for us to keep track and also for us to recognize that these are issues that are happening currently in this year. Just to highlight some meeting tips, for those of you who have experienced this before, it's a long day and certainly there's not a lot of time oftentimes to meet with the members and staff because they have a lot going on in their day. We try to keep meetings under that 10-minute mark. Sometimes we stretch it to 15, but just understand that these meetings will be very succinct and tight as far as time. And please be respectful of the members and staff as far as their availability. In regards to just kind of the meeting itself, you often hear about politicians going and it's one of those, let's sit around the kitchen table and have a conversation. Well, truly, that's kind of what it's like for those who have not done this before. It's very, very a relaxed environment. Oftentimes, you know, you are sitting in either in the member's office or an office within his office suite. I will say sometimes, however, based upon space and if there are a number of meetings going on, you might just have your meeting out in the hall right outside their office. So please don't be surprised. But as regards to just the meeting itself, certainly as far as introductions, make sure you state your name and what city you're from or town. The members take note of who in the room is their constituent. Again, give an overview of the issues I just ran through and requesting support for those pending bills. But I think the key message here, which is this third bullet point, is to share your personal story. How can you tie in any type of personal story that you have as it relates to the issues that we are, you know, discussing, but more importantly, how these conditions may impact you personally and or someone you know. Please stay focused, and again, keep these conversations respectful and polite and very simple. I mean, you don't have to talk, you know, that 30,000 point view with a lot of detail. And certainly because there won't be a lot of time, and the information that we're going to be sharing will help fill in the gaps. Show openness to reasons if a member is opposed to an issue. I mean, we're in an election year. Oftentimes some people may come across very political, but again, just be open to what, you know, their reasons are, because everyone has an opportunity to agree and or oppose. But certainly we want to take note of those that are opposed to the issues that we're presenting and why. Again, offer to get any answers to a question you don't know. It's certainly okay to say, you know, may I get back with you and get the answers that you've asked about or the questions you've asked about. And certainly we'll turn around and get those responses back to the member and the staff. Summarize any commitments that have been made. If a member has said, yes, I'll support this, or, you know, if there are other types of commitments that were made, please take note of that. And last but not least, certainly say thank you. They certainly are giving up some time to have those, you know, individual meetings with you and take time out of their schedules. They are in session next week, so, you know, they may be bouncing a lot as far as where they need to be at what time. So just be open to kind of moving and grooving with what is presented to you on the day of the meetings, because it might not be as relaxed as you would have thought, and or as far as just having to kind of shuffle around, and it might not be in the member's office as you might think, because sometimes too I've had where I'm actually walking and talking with the member as they're headed to the next meeting. So I would say kind of anything goes, just be prepared, which leads to this next slide. Whoops, I apologize. The one thing I did want to mention, which I think I passed a slide, is, you know, when we talk about being prepared, we want to talk about, you know, making sure you have, you know, comfortable shoes, when you're coming, and certainly be mindful that you will be going through metal detectors. So it's kind of like going through the airport where, you know, your belt buckles, cell phones and things will have to be come off and go through the metal detector. Oftentimes I've had jewelry that would, you know, cause the metal detector to go off. So there are places, little containers that they'll have you put that in. So I would say, as you're leading up into the building to hit those metal detectors, I would start peeling off what you think might make the metal detector go off to keep the line going so you can get to your meeting in time, because knowing that they're in session next week, there may be, you know, some lines trying to get into the building. So I just want, hopefully you could get in as quickly as possible. Here is an outline of the agenda for those 2 days. And I say 2 days as we are hosting a welcome reception the night before. Please join us if you are in town at that point in time. It's right there at the host hotel around the corner. Literally, you can walk. During the host reception, we will be recognizing one of the country's local asthma management programs. The Environmental Protection Agency will be on hand to give that award. It's called the National Environmental Leadership Award in Asthma Management. So they will be doing that award on that evening. So we hope that many of you will join us, and you'll get to meet all the staff from the network at that event as well. And some of our board members, I must say. On Wednesday, we start very early because we have a long day, and I say very early because most of these meetings will start around 9 o'clock. We're giving ourselves from 9 to 5 to do Hill meetings. So please be mindful of that. We do have a full breakfast, and I mean full breakfast, starting at 7. We're going to start the program around 7:30. We have a lot to unpack during that time frame before we head you off onto Capitol Hill for meetings. If it is a nice day, it is a pleasant time to walk if you have time. We are not far from the Capitol, and the meetings on the Hill were the House and Senate side of the Capitol. And then also in regards to the lunch briefing, it is only from 12 to 1. It is a brown bag lunch. You can drop in and leave out based upon your meetings. We are hopeful that many of us will not have meetings that interrupt that time frame because we have a packed full of speakers, some of whom are members of Congress, federal agencies. Hill staffers will be present as well. So again, that will be available for you to come in and get lunch. And even if you can't stay, please come and grab a box lunch to take with you. As I mentioned about our speakers, these are the speakers we'll have at both the breakfast and the lunch, just a myriad of speakers. So you'll hear from the co-chairs of the Congressional Asthma and Allergy Caucus in the U.S. House of Representatives, Congressman Valadao from California, and Congresswoman Debbie Dingell from Michigan. You'll hear from Dr. Kiley, who is at NIH, Mr. Edwards from the Environmental Protection Agency, EPA. You'll hear from the president and chairman of Advocacy from the American College of Allergy, Asthma, and Immunology. You'll hear from our own network's Chief Health Equity Officer, Catherine Blackwell. And we also have 2 amazing families who will share their stories about living with asthma and severe allergies at our breakfast and lunchtime briefings. And I'm sure you will be very touched and understand why it's so important to do what we're doing and advocating for those who live with these conditions, and certainly even if it's for you personally. I touched on this a little while ago in regards to materials and handouts. Everything will be provided to you by a hard copy at the breakfast. I know we have sent some information via email. There's information on our website, but this you will have things in hand. The agenda, the talking points, as I referenced, the sample social media post, and then the leave behind information. That leave behind information is what you're going to leave with the staff and the member at your meetings. We'll have folders for you to hand out to them. I will also tell you that Soapbox is really great. They actually send that information electronically prior to the meeting, so the staff have time to review. Now, I will tell you, they don't always have time, so it's always great to come in with a hard copy. Hence why we have leave behind information. So that information that's going to be left behind will include the bills that we're going to be asking for support and some other materials that we'd like to highlight. The attire for next week is business or business casual. I will say, honestly, whatever makes you comfortable. I mean, you are coming in as a constituent. I've seen all sorts of things. I mean, oftentimes too, there are groups where they are coming in their, coordinated t-shirts and things of that sort. So again, the goal is to be comfortable, but obviously, no cutoffs, this, that, or the other. And again, I can't say it enough to wear comfortable shoes. Ladies, I know I've used to pound the pavement with heels on, but when you're walking marble floors, it doesn't last always. So please be mindful of that. I also talked about the metal detectors, and certainly, again, it's going to be like what you've seen in the airports. So just be mindful of what you have on your person, or make sure that you remove it prior to entering into the metal detector. And then lastly here, I just wanted to kind of highlight those who have kind of been with us over the years. we are certainly here to create a healthcare system that is fair, inclusive, and responsive to the diverse needs of all individuals and communities. And we feel like that is critical. And with our collective voices, we can break through the barriers that exist in our healthcare system to help create opportunities for anyone living with allergies, asthma, or a related condition, leading to a healthier life with better health outcomes. And with that, I'm going to pass it now to Kevin Schultz from Soapbox. And Kevin, as I mentioned, I will help change your slides. Just tell me when.
Sounds great. Thanks, Charmaine. Hello, everybody. I'm Kevin Schultz. I'm with Soapbox. We have the pleasure and the honor to schedule your meetings on the Hill. And I'm going to take you through your day next week. And then I'll also tell you how you'll see your preliminary schedule tomorrow. But let's first start with some of the numbers. There's about 100 of you who will be going to the Hill next week from 28 states, and you'll be conducting about 126 meetings in just the span of a few hours. 48 of those meetings will be with Republicans, 77 will be with Democrats, and 1 will be with an independent. So if you see a blue dot near where you live, you know you're represented by a Democrat. If you see a red dot near where you live, you know you're represented by a Republican. All right, let's go to the next slide, please. Tomorrow afternoon, you will receive an email from Soapbox that reveals your own individual schedule in real time. If you do not get that email, do not worry. It will be on your printed schedule, and you can certainly let Charmaine know, and she'll let us know, and we'll resend it to you. Sometimes it just ends up in a spam filter, but you can let Charmaine know, and she'll let us know, and we'll resend that email to you. So what it does is it gives you a code. You go to the Soapbox mobile tool and you can see your schedule in real time. There is no app. I want to repeat that. Soapbox does not have an app. It's simply a website. So we call it the mobile tool. That allows you to see your meetings in real time so you can see the changes happen. The first time you go into the mobile tool, it will ask for your cell number. The reason it asks for your cell number is so that we can text you with changes on the day of the event. Let's go to the next slide, please. I want to show you a little bit more about the mobile tool. So the most important button on this mobile tool, once you put in your code, is that red button at the very bottom there. That is so that you can get our help desk number. So you will have live assistance all day during the Hill Day. We have 10 people here in our office waiting to help you. You won't get a recording. You won't get something that says, please press 1 to get this. You'll get an actual person. So just call us if you're running late, you're in a long line in security, and you're worried you're going to be late. Don't worry, just call us, and we'll call ahead to the office and let them know that you're on your way. Some other buttons that I want to point out, there is a button for the bio of your member of Congress, if you want to do a little research ahead of time. There is a button for the U.S. district map, so that if you want to see where your House district begins and ends, you can do that. There's also a button for documents. So Charmaine is giving us some of the documents ahead of time. We will email those to the staffers before your meetings, but then we'll also put them in the mobile tool so you can keep an eye on those and email them to yourself if you like ahead of time. And then a button for your team so you can see who you're going to your meetings with. Sometimes we pair people who are the only ones from their state with somebody else who's alone in their state. So you might see another state on your schedule. So when you go to your team, you'll see who that other person is from that state. And then there's a button for your meetings, which will be listed in time order. The most important part of the mobile tool to Charmaine and your DC government relations team is the feedback portion. So if you see underneath this meeting, this sample meeting here with Tom Cotton, there is a feedback button that has a little megaphone icon. I want to show what happens when you press that button. Charmaine, if we can go to the next slide. When you press that megaphone icon underneath the meeting, you'll then get the feedback portion of the mobile tool. So you don't have to...
Kevin, did it happen? I'm like trying to follow.
No, it's still on the same one. So if we move forward, you'll be able to see the feedback portion, I think, to the next slide.
There we go.
There you go. So when you press that megaphone icon, the questions will come up. You don't have to say who you are because it already knows that because you logged in earlier. You don't have to say which meeting you're talking about because you're pressing that icon under the meeting. You simply need to answer the questions and then hit submit when you're done. If by chance the member of Congress pops in and you take a photo, you can even upload that photo to the feedback form by just pressing that little camera icon, and then you can upload the photo. And I got to tell you, Charmaine loves to get those photos because then she can use those throughout the year. She gets to see how great your meetings are going. So please take as many photos as you like and upload those to the feedback form. All right, let's go to the next slide, please. So when you get to town, you will get a printed schedule. So we do everything old school and new school. If you're the type of person that doesn't like to use your phone for everything, you only want to use it for phone calls, not a problem. We're going to give you a printed schedule here. So let me tell you what you'll see. You'll see your name and your district on the upper right corner. Below that is our help desk number. And to the left of that is your mobile tool code. So if you didn't get that email, you'll have it right there. So you can put in your code and see your schedule on the mobile tool if you like. Some other things about the printed schedule, you'll see your team there on the right side. And then to the left of that is a list of the meetings in time order. If the meeting says with member, you are on the schedule of the member of Congress. If it says with a staffer's name and title, that is the person you'll ask for when you arrive to the office. And we put a little legend at the lower left that tells you what the staff titles stand for. So if it says with Joe Smith, COS, you can see that COS stands for Chief of Staff if you look at the lower left. And then there is the building and the room number. And then we are tracking a few things on the schedules. You all have told us over the years you like to know a few things about your members of Congress before you even go into the meeting. So we've heard that, and we will track the key committee members. So if your member of Congress is on one of our key committees, the committee will be in brackets on the same schedule line as your member of Congress. And then tomorrow, I'm going to meet with Charmaine, and we're going to talk about some other things that we'll track on your schedules, which I am assuming we will track the co-sponsors of those bills, like the Safe Step Act, the Help Copays Act, the Cummings Family Asthma Act, Dillon's Law, EpiPen Act. We will make a little key word there on the schedule so that you know if your member of Congress has already co-sponsored that bill, and you can say, thank you, and watch them light up when you thank them for doing something. Not everybody does that. So we just like to track those on your schedule so you know before you even go into the meeting without having to flipping through a lot of paper whether your member of Congress has already done something for us. Let's go to the next slide. On the back of each printed schedule that you will receive when you get to town, there is a map of Capitol Hill. And there's a few things I want to point out to you. We have marked the accessible entrances to each building, so you can see those there. We've also marked each entrance to the building. So there's like these gray shaded boxes or rectangles that you can see. If we use the Senate office buildings as an example, as we're looking at the slide on the upper right, those are the Senate office buildings, Russell, Dirksen, and Hart. And you can see those little gray shaded boxes. Those are the entrances to each. And I point those out because if you go up to one of those shaded boxes or entrances and you see a long line for security, you can always just go around the corner and see if there's a shorter line when you go around the corner. So that's why we point out where the other entrances are. We mark if there is coffee and food in that building. And then we also mark the estimated walking distances between the buildings, so you know how long it takes to get from one to the other. And I also want to point out that each of those Senate office buildings are connected by basement hallways. The reason I bring that up is because once you go into one of your Senate office buildings, if you have a meeting in another Senate office building afterwards, you don't have to go outside and go back through security. You just go down to the basement and over, so that you only have to go through security once. In fact, Dirksen and Hart, the two buildings on the upper right, they're connected in even more places than just the basement, so that makes it a little easier. Most of you have your Senate meetings in the morning, and then you have your House meetings in the afternoon. So when you go from the Senate side to the House office buildings, which are on the south side of the Capitol, most folks walk those 5 or 6 beautiful city blocks. It takes about 15 to 20 minutes. You can take a cab, you can take Uber if you like, but most people walk those 4 or 5 city blocks. And then the House office buildings, Rayburn, Longworth, Cannon, all connected by basement hallways. So once you are in one of those buildings, you are very close to your next House office building. I mention that because we have asked for each of your meetings to be 1 hour apart. If you notice that you have meetings 30 minutes apart, you'll notice that it's on the same side of the Capitol. So it's going from a Senate to a Senate meeting or a House to a House meeting. And it's also because the office told us they couldn't give us that hour slot. So when that first meeting begins, you can say, hey, we've got a meeting on the half hour. We're happy to keep this meeting to 20 minutes. The office will find that very gracious that you're telling them that, and then you'll have plenty of time to get to the next meeting on the half hour. And if you're running late, you'll call our help desk and we will let them know. Let's go to the next slide, please.
And Kevin, before we leave this slide, I just wanted to comment about the map here. If you look at the top left-hand corner where New Jersey Avenue is stated, along that route, about 2 blocks is where our host hotel is. So again, as I mentioned, if the day is nice, it really doesn't take that long to walk towards the Capitol up New Jersey Avenue to Constitution. So I just wanted to highlight that.
Thank you, Charmaine. So briefly, I'm going to talk about the schedule distribution, and that is that when you're in town, what we do is we have you seated by state so that you're with the other people that you're going to your meetings with. You'll get a large envelope by state, and then you'll pull out the individual schedules and hand them out to the other people at your table. And then if you have any unclaimed schedules, you'll put them back in that envelope and bring those to our help desk outside the conference room with any questions, comments, or needs. I'll go over all of those details when you're in town, but I just wanted to briefly tell you that's why we have you seated by state. So when you walk into the room that morning, just look for your state table tent, and that'll make it a little more quick for you to get your schedule that morning. Okay, so before I hand it back to Charmaine, I just want to mention that you will be getting that email from Soapbox tomorrow afternoon. Again, if you do not get that email, check your spam filter. It might be in there. And if you don't find it there, ask for Charmaine to send us a little note and we'll resend it to you. All right, thanks, Charmaine.
Great. Well, thank you very much, Kevin. We are now at the point for any questions. I see one, will any meetings be virtual like Zoom? We have not heard that any meetings will be virtual now that members are in place, but Kevin, can you address that, please?
Sure. I do think there is one that is virtual, and it's Senator Cardin. So Senator Cardin's health team meets virtually only. So that's why we accepted that. We try not to schedule any virtual meetings anymore, but because they say that's the only way we'll get a meeting, that one is virtual. You can use your phone for that. You can find a quiet spot or go down to the cafeteria and you can take that meeting virtually. Also, I should point out, you will see TBAs tomorrow when you get your preliminary schedule. That is not a declined meeting. TBA simply means we're awaiting that office to confirm a meeting time. And about 15% of the offices wait until the day or two before to confirm a time. So I just want you to be aware you will see a few that say TBA when you get those tomorrow.
Are there any other questions that will pop up in the chat here? Okay. Seeing none, let's see if I can move these slides along here.
Joanna is asking if we will get the paper schedules at the breakfast. Yes, you'll get that morning at the breakfast.
Yes, thank you, Kevin.
Mm-hmm.
Yeah, so again, we want to thank you for joining us today. And as I mentioned, this particular webinar will be available on our website. So you'll be able to re-listen if you'd like, or for anyone that you know that might have missed it, it will be available for them to listen to. As both Kevin and I will be addressing the group at the breakfast, so we'll kind of be reiterating some of the points that we talked about during this Zoom. And as I mentioned, as we mentioned, Kevin and his team will be armed and ready with ready to assist you in any way as it relates to your schedule, and certainly be with us throughout the day, manning the ship and letting you know if a meeting got rescheduled and or had to cancel, or just anything honestly related to your meetings, and we'll be in touch throughout the day. We certainly appreciate tremendously, just all of you all taking the time to come to Washington to bring your voice, because it does matter. It does. It's kind of a, one of those things I tell my children, it's your civic duty to really kind of bring what's going on within your personal life and certainly what's going on back home to those who represent you in ways that can help change policy. And that's what we're here to do, to make the lives better for those that we love and those even within ourselves that are really, challenged by these conditions called asthma and allergies and all the other related conditions. So again, we thank you for your time. My contact information is up on the screen. Please reach out if you need anything between now and the time we meet on Wednesday. So again, we thank you so very, very much and have a wonderful evening.